Sorry. And we're ready.
Okay, thank you, Alexander. Welcome everyone to another Monday meeting for Telehealth Today. Today we have a special treat. One of our first practitioners, nutritionalist, Dmitry, and he's going to explain what you can expect if you were to book an appointment with him and how he can help you through your journey, especially in eating better and feeling better. So, Dmitry, take it away. The stage is yours. Thank you for being here.
So, thank you. It's dietitian to be more precise, but that's okay. My presentation talks about the difference between nutritionist and dietitian. Okay, so let me share my screen right now. It says host disabled screen sharing.
Sorry, just give me one moment.
That's okay.
Okay.
Okay, let's try again. Full screen. Okay, now I have it in full screen mode. Okay, so once again, my name is Dmitry Novikov. I am a registered dietitian. I have been licensed in the state of Florida for almost 6 years now. And today I'm going to be discussing collaborative practice development. The target audience is mainly for consultants, other providers for collaboration, but if there's any prospective, patient or client, there's going to be some info here as well. Okay, so without further ado, so about Vero Nutrition Wellness, so the mission statement, providing high quality nutrition therapy services for the application of evidence-based principles and unconventional principles. So to break that down, what I mean by evidence-based is looking at the academic research and seeing what works and excluding the stuff that doesn't really work, doesn't really have the evidence to back it up. So that's called evidence-based practice. It's something that has been going on in the medical field and also in healthcare for at least 2 or 3 decades now. With regards to unconventional principles, what I mean by this, we don't want to be like a cookie cutter practice or organization. We want to utilize methods that other places are not using. So beginning with the brand name, actually. So when figuring out what to call the practice, I decided not to use my name. I decided to give like a more neutral branding to it, to give it like a door open for diversification, greater opportunities, like greater diversity in terms of what can be provided. Scope of practice and the initial stages will be, of course, as you would expect, medical nutrition therapy with or without nutritional counseling, which I'll get to that later. And here are the uniqueness and niche factors. Considerations of the built environment. So when I say built environment, I'm not necessarily talking about plants, trees, the ocean. I'm referring to our social systems, our society as a whole. What are the influencing factors in society that either encourage or inhibit attaining a patient's goals, right? So if there's socioeconomic factors or psychosocial factors, that has to be addressed because any dietitian can give out goals and a nutrition plan, a diet plan. But if these built environment of the other factors are not addressed, the patient or client may have difficulty meeting those goals. So that's very important. Personal touch. Many healthcare establishments, they seem to be kind of like I mentioned at the beginning, cookie cutter, not really personalized to the patient or client. And so by putting emphasis on that, we could achieve greater results. Use of technology and applications for a personalized approach, kind of, going back to the bullet point number 2. When I say applications, and this is like the long range plan, further down the line, 2025 and beyond, have applications on iPhone or Android device, because everybody carries these things. Have those applications that can track the goals that are being set. It doesn't involve a lot of intensive coding, because we're not trying to do anything super complicated, just to track goals. Engagement with interdisciplinary team members, where circumstances where the intervention falls outside of a dietitian's scope of practice. So like, let's say a patient is not responding to motivational interviewing. Then at that point, it may make sense to refer that patient to something like CBT, which can be done by a psychotherapist provider, which can also be under the Vero Nutrition Wellness organization. So, stages of development. That's good. Stage 1, as you can see, the IT infrastructure is 95% complete. Reason why it's not 100%, because it's like a minor technical hurdle that I'm working on resolving. So there are like EHR solutions out there, and I'll list a few. Things like Simple Practice, Calyx Health. There's like plenty of others. They're very good at giving progress notes and assessments, the data entry and retrieval of this information. But what about other information, such as documentation from the physician, or documentation like made by the patient or client, themselves. Insurance, if insurance is going to be billed. So all of those things count. Not to mention HIPAA compliance. So I've been working hard to make sure encryption is enabled. Stage 2, kind of halfway there with marketing. Web and email hosting is simplified because that's outsourced to the cloud. Video and electronic marketing. Stage 3, simulations. That's when I do dry runs, see everything is nice and smooth. And stage 4, pending official launch of services. Okay, so this next slide is about regulatory compliance for US audiences, but this may also apply in other jurisdictions as well, particularly in the English-speaking world, like United Kingdom, Australia, and elsewhere. So a lot of people are confused, like, what's the difference between nutritionist versus dietitian? Well, the title nutritionist, it's not recognized, not regulated in the USA. So what that means is anyone can just wake up one day and call themselves a nutritionist. You don't need to go to school for that. Anybody can call themselves that, just like anybody can call themselves like a coach. Not saying that's a bad thing. That's just how it's defined. Now, the title dietitian or registered dietitian, it's protected and regulated title. So most U.S. states, not all, like some exceptions are New York, Arizona, maybe California. But the laws in most states, including Florida, restrict the use of dietitian or registered dietitian only to authorized or licensed persons. So I have a license from the Florida Department of Health, license number 8796. And I also have the credential from the Commission on Dietetic Registration. So that's the difference. And of course, you do need to go to school and do 1,200 hours of supervised practice, which is something that I did years ago. So as you can see, Dietetics Nutrition Practice Act, that's the statute that enforces the law and sets the framework for regulation. So with the exception of general weight management, it's illegal for nutritionists to engage in the provision of medical nutrition therapy. So I'll give some examples. It's legal for a nutritionist to engage in general weight management. Often I hear this happening a lot at gyms. Gyms have personal trainers, and sometimes the personal trainers, like whether they call themselves a nutritionist or not, they practice general weight management, give them like diet plans, some strategies, ideas on how to lose weight or maybe gain weight or gain muscle, whatever the goals of the client are. So it's general weight management. It's generally allowed. It's legal for nutritionists and anyone else to do. But things like diabetes or dialysis or chronic kidney disease, when a patient is not quite at stage 5, but stages like 1 through 4 of the chronic kidney disease process, disorders related to the endocrine system, nutritional management for that. The laws and regulations state that that has to be done by a registered dietitian. And so that's the distinction with the title. A nutritionist is unregulated, unprotected, whereas dietitian, it's regulated and protected, and only the dietitians, they're allowed to do the medical nutrition therapy stuff. But general weight management, anyone can do that. The non-governmental regulator, that would be the Commission on Dietetic Registration. So that's the entity that issues the credential, which is then cross-referenced by individual states. Okay, so Florida state statutes, there's a 7-year rule for clinical records retention. I don't know exactly how it is with other states. Other states specify 5 years. Florida specifies 7 years in most cases. The reason why I talk about this is because this is one of the things everyone who is licensed has to do to stay out of trouble, right? I can give a story of one healthcare provider that I know. First, for whatever reason, when she saw her clients, she wasn't keeping progress notes, wasn't making assessment, wasn't keeping progress notes. And then when one of the patients or clients went back to her requesting those records 2 years later, she wasn't able to provide records. And nothing happened with her because she wasn't reported. But if that client did decide to report her to the Florida Department of Health, then at this point she would have had her license revoked or at least suspended. So this is very important. There's like a 7-year rule for retaining clinical documentation, which applies in Florida, and for the most part, up to 7 years, it applies to other U.S. states as well. So that's very important to keep in mind. Another part of the law is referring a patient out in the event where something that needs to be done by a dietitian but can't really be done because it falls outside of scope of practice. I'll give one example. Let's say a client comes in with a really elevated hemoglobin 1C. Hemoglobin 1C is like maybe 8 or 9%, which is like quite high. Sure, the dietitian, like myself, can talk about glycemic indexes or consistent carbohydrate intake to help lower that hemoglobin A1C. But also what may really be necessary is medication management of insulin or other diabetic medications. So as dietitians, because we're not doctors, we're allied healthcare professionals, we can't write prescriptions or physician orders. So that has to be referred out. But why refer out to an external physician when you could have that physician or at least physician extender, like advanced practice registered nurse, be under Vero Nutrition Wellness. So I think this is where IDT collaboration comes in. I see so many, like I've heard other, dietitians or psychologists or whatever, they name a practice, after themselves. So their name and something else after their name. And I asked the question, why? Why do that when you could have a more broader name, broader branding to expand your scope? Because this can allow collaboration with interdisciplinary team members. Long range extension plan. So this is not this year. This is like for next year, 2025 and beyond. So this is like this is what I call long-term goal setting. Partnerships with physician and physician extenders. So physician extenders would be the mid-level providers, your advanced practice registered nurses or physician assistants. Just with the case of dietitians, the regulations, it's different state by state. But as with the case that I mentioned, having this hypothetical case of a client, hemoglobin elevated at 8 or 9%, I don't have the authority to write a prescription or instruct the patient like what medications to take. That's not legal. So forming a partnership with physician extenders can remedy that problem. They would be able to adjust the dose or change insulin or diabetic medication or anything else that needs to be adjusted. Partnerships and potential hiring of psychotherapy providers. This is very useful, beneficial if motivational interviewing is not enough. The thing about motivational interviewing and also Rogerian methods is that Carl Rogers himself wrote in his book that it's not necessary to have expert knowledge of the mind and psychology to practice motivational interviewing or non-directive interviewing. It's not necessary to do that, which is why it's legal for dietitians and maybe registered nurses if they have experience of that over people. This is why it's legal for them to practice motivational interviewing. But what about if the patient needs something like CBT or maybe EMDR? That's totally outside the scope of a dietitian scope of practice. So in this case, having this partnership under the Vero Nutrition Wellness banner, we could internally refer that patient to a psychotherapist provider in-house to work on achieving nutritional goals. Not always, but I find this to be especially true for the morbidly obese populations where the etiology is psychosocial and psychological in nature. Oftentimes with this demographic, it might be 9 o'clock or 10 o'clock in the morning. They've already had breakfast, and already in their mind, they're contemplating what they're going to have for lunch, dinner, next breakfast. So that can be useful in those circumstances. Third bullet point is CMS regulated facilities. Now, this is, I'll explain what this is. So CMS is Centers for Medicare and Medicaid Services. They are the regulator and also the government insurance provider for anybody with Medicare benefits. And they certify facilities regulated by them, such as dialysis clinics and skilled nursing facilities. Now, dialysis clinics, it's kind of like a closed market, but with skilled nursing facilities, they're open to contractors. So, and the thing about skilled nursing facilities, whether patients at the skilled nursing facilities, whether they want the services of a dietitian or not, the regulations say they still gotta be there. So what does this mean? It means that the demand for dietitian in the skilled nursing facility is inelastic. No matter where the economy goes, it's a steady revenue stream. This is another thing that can be added to the Vero Nutrition banner further on in later stages. Last bullet point, which is something that I alluded to at the beginning, is Vera Nutrition Wellness branded clinical software and applications. So, we can just I or anyone else. Anyone else listening to this, whatever it is that they do, branding, doesn't have to be limited to pens, business cards like flyers. You could develop applications on the phone or iPhone or Android that help patients, clients attain a certain goal, and that will have like the branding, but also that personalized connection, because off-the-shelf applications, they can't be like really customized to fit the needs. So, but if you have your own application and it doesn't take a lot of coding, it's not like trying to design a ride-sharing application or a financial application or anything complex like that. Just an application to help somebody meet their goals. That can also be useful. So with all that being said, this is my name, of course, so my contact information, my email, and my phone number. This phone number is also available on WhatsApp and Telegram. So anybody who feels more comfortable contacting me on WhatsApp, Telegram to avoid the fee, long distance fees, you can contact me there as well. I'm not quite exactly at the launch stage, but I'm open to information and ideas. I'm leading up to the launch stage, and this is the strategy that I have, developed going forward. I'm hoping that everyone listening here can find this to be useful in their practice development as well. And now I'm open to questions, comments.
Yeah, I can start. I have a few for you.
Go ahead.
Thank you for the presentation that was knowledgeable, and it helped address certain things, but other certain things. So the first one I have, I guess, would be, so you touched on how anyone can kind of be a nutritionalist, and some people take the government up on that and try to be it just from their own research and whatnot. You actually have the benefit of schooling, of the 1,200 hours. So I guess my question to you is, let's say someone in good health or normal health that has never done anything with nutrition, what benefit would they get from booking with you as opposed to a nutritionalist that has just researched on their own but hasn't had the schooling or experience that you have had?
That's a good question and an excellent question. So a nutritionist, because they're not licensed, they wouldn't really have the direct connections to other licensed professionals like doctors and just other medical professionals. But a dietitian, by virtue of having that license and credential, like I do, I have direct access to other doctors, the medical director where I work, like other connections. And why that's important is because it's easy to make that referral or link with that doctor, so that doctor can, like, let's say, if the patient doesn't really know where to begin or what's wrong with them, then at that point it's worthwhile to do like an investigative assessment, kind of like when you're doing like a physicals checkup. You go for a checkup, not necessarily because like something is wrong, but like the checkup, as the name implies, it's there to figure out whether or not everything's okay. So going back to that, kind of like an investigative like assessment or just assessment, I can ask the physician or a physician extender to write a prescription for the comprehensive metabolic panel. And what is the comprehensive metabolic panel? The comprehensive metabolic panel, it will tell you whether your electrolytes are normal or not, whether your hemoglobin A1C it's normal or not, whether your creatinine. That's a big one because a lot of the people who end up on dialysis, it's by surprise. They have high blood pressure, no symptoms. That's why it's called a silent killer. And then all of a sudden their creatinine goes up, indicating impaired renal function. So yeah, going back to your question, what would be the benefit? Well, I would be able to, ask the doctor for a prescription. Like lab testing in the United States requires a prescription. I know that in other countries like Russia, other European countries, other countries, there's no prescription involved required for blood work, but in the United States it is. So I would be able to make that connection. And then once I have the results of the blood test, I'll go over, see if what's in normal limits, what's not in normal limits, and anything that's not in normal limits, anything that's elevated or too low, that's where I can begin the conversation about nutritional assessment, nutritional therapy. Does that answer your question?
Yeah, I think
Okay.
so. Basically, you have a lot more resources and different testing, and you've learned how to assess someone's health more for preventative care so that you can get them on the right track to a brighter future, essentially.
Correct. Yes.
Yeah, that's good. Awesome. Thank you. Now another one, and I apologize if I missed this, but I don't think I did. You had talked about most people in your line of work using their name as part of the name, similar to a lot of law firms where they use the name of the person. I see that you didn't. Why did you choose Vero Nutrition? What's the significance in that, and why you chose that?
So the significance is that it opens the door to broadening the scope by including other providers and just broadening the scope.
No. I mean, yeah. in your specific name.
Oh well, well, the name of I tend to like I like to follow principles. So Vero follows the principle of truthful. So I think like advertising the principle or the implied messaging behind the name, I think that's more important than the name than the name itself. But that's just my personal perspective.
Okay.
Because like the name Dmitry Novikov, that's just a name. It doesn't say it doesn't give any underlying messaging. It might give a clue to somebody that I'm from Russia or Eastern Europe, but beyond that, it doesn't give any underlying messaging. But something like Vero Nutrition Wellness, emphasis on Vero, that does give an implicit meaning behind it.
Yeah, and I think that when you said it meant truthful, that's what I was looking for.
Yes.
So it's basically expressing that in-depth, detailed, truthful look at what you're doing based on math and science.
And by nature, I'm a detail-oriented person. So, yeah, I would concur with that. Yes.
Okay. Very good. Very good. Thank you. Okay, and then I guess the one last one I had for you. What's your process? Like, let's say somebody books an appointment with you, 35, normal health. They just want to make sure that everything's good. And they say, analyze my diet, tell me how I can be better. What's the process that you do with them? Like, how do you take them from A to B? Where do you take them? How do you do it?
Okay, excellent question. So for the for the dietetics profession, we have something called the nutrition care process. So on the dietitian side of things, on the professional side of things, we always begin with assessment. That's a big one. Because the diagnosis, and for that matter, the treatment, the treatment, the outcomes, the diagnosis, that's only as good as the input or the source information. So that's why assessment is important. We always want to assess. We don't want to diagnose first and do assessment later, or do intervention at the same time as assessment. Although that does happen, in other roles. For dietitians, we always focus on assessment. It's something called the ADIME. So A begins with A stands for assessment, like I mentioned, gathering information and synthesizing that in a deductive reasoning thought process, leading to a diagnosis. So based on the deductive reasoning of all the source information, what the patient says, that's subjective information. What the data says, prior medical history and lab results, that's objective. Synthesizing that together, leading to a diagnosis. So that's stage 2, diagnosis. Once we have a nutritional diagnosis, it's different than a medical diagnosis because, dietitians, they're not allowed to do medical diagnosis. They can only do nutritional diagnosis, which is different. But once we have that's where we formulate the intervention. So the intervention, as the name implies, is the actual doing of things, like setting goals for the patient and helping him or her achieve those goals. And if they're struggling to achieve those goals, like look at what's in the built environment, try motivational interviewing. If they don't respond to motivational interviewing, refer to therapist provider for CBT, perhaps. So that's the intervention stage 3. And then the 4th and 5th stages, which actually happen like during the course of intervention, is called monitoring and evaluation. So as the intervention is ongoing, we want to monitor if there's any progress being made, right? And so how do we monitor? Well, we set certain parameters. If the goal is to lose weight or gain weight, then the obvious parameter would be their weight. But what if there's concern about diabetes management? Well, then we would have at least 2 parameters. We would have glucose, which is like a short-term parameter metric, and then the long term would be hemoglobin A1C. And then like other parameters for other conditions as well. And then the 5th stage is evaluation, seeing if there's progress being made. If there's not really progress being made, then kind of reassess. So the cycle like repeats itself at stage 1. But that would be the process from the professional side of thing. That's actually a really good question, and perhaps I should have included that in my PowerPoint. If anyone listening wants to write this dime, it's called ADIME. So A as an assessment, D as in diagnosis, I as an intervention, M as in monitoring, and E for evaluation. And it's part of the dietitian's nutritional care process. So that's what we use. Now, for the patient side of things, they wouldn't be too much involved with assessment or diagnosis other than, giving information to me or another dietitian. On the patient side of things, they would be exposed to the intervention and just, forming that connection with the dietitian on making sure the intervention will work, making sure the results of the parameters meet the desired goals.
That was a good answer, especially the last half a sentence there. That was good. Thank you. And just to clarify, so one more follow-up question to that. Because yeah, you said the word diagnosis, but you clarified that it's different than a medical diagnosis. I actually
Yes.
Googled the word, and it says, the process of identifying a disease, condition, or injury. It's not a disease or an injury in this case, maybe a condition, but I guess what you're doing is basically just giving them a reference of where they are. So I guess in the rare case to where that 35-year-old comes, there might be a really rare case where he's doing everything right. He's eating exactly what you'd want him to. And in that case, the diagnosis might be, hey, you're doing good. Just keep it up. Just do what you're already doing. That's correct. Or in a lot of other cases, the diagnosis might be you need more vitamin, whatever, or this or that. But it's basically an individualized treatment plan for each individual. Is that fair to say?
Correct. Yes, that's right. And more on the point about individualized, because if you look at a medical diagnosis, like for example, like if you open a medical chart, on the face sheet of the medical chart, you'll see a list of codes, like ICD-10 codes and their respective diagnosis. And the diagnosis might be 1, 2, or maybe 5 word length at max, like end-stage renal disease or type 2 diabetes mellitus or obesity. The medical, having said that, the medical diagnosis, it tends to be shorter, but the nutritional diagnosis, it's more broader. So it begins with the problem, then followed by the etiology, then followed by the sign and symptoms. Sometimes there's like a code attached to it, which is different than ICD-10. We use a different system. But yes, it's something to that effect where it tends to be like somewhat broader in scope. And just because somebody has a nutritional, this is important because just because somebody has a nutritional diagnosis doesn't mean that they have a medical diagnosis. I mean, it may, but or it may not. It just all depends.
Yeah, no, I get it. And it sounds
Yeah.
like everybody that sees you, you're going to give a nutritional diagnosis too, because
Yes.
that's kind of what you do. Yeah, that's good.
Yes.
Awesome. And then one last follow-up question. So if somebody books with you, how long would this process take? Like, is it like a Q&A for like an hour and then you kind of do your thing and then give them the results later? Or is there blood work involved? I guess a lot of it depends on the individuality, but what's a general ballpark, I would say, for the process?
Okay, so the general ballpark for dietitians, and I'm talking about broadly in the field, is it ranges from 45 minutes to 60 minutes for initial assessment.
And that gives you enough to do your thing?
Right.
Okay.
I'm opting for 60 minutes because 60 minutes as opposed to just 45 minutes, that's more conducive for that personalized touch, that personalized, individualized approach. So that would be the initial appointment, and then follow-up appointments are of a similar length. Compare that to other places where it's just like 15 minutes or just 30 minutes, not much that you could, do there. So 60 minutes is more conducive for initial and follow-ups.
Okay. I think that's it for me. Thank you. Thank you.
Yeah, you're welcome.
Does anyone else here have questions for Dmitry? I know if not, people watching the replay, you can put them into YouTube, and then we'll forward those questions on to Dmitry as well if you have individualized questions, or if you're watching the replay, have something you want to ask.
I'm guessing by now my contact information has been here long enough, so I'm gonna turn off the screen sharing. Okay, there we go.
Okay. Well, awesome. Thank you for sharing that. Thank you so much. If you want to book with Dmitry, he left his contact information on there. Of course, you can find him on Telehealth Today. Book an appointment with him, get that initial assessment, and he will tell you how to make your diet, have you live a happy and healthy life, I suppose, is the goal here. So, yeah, thanks for being with us. And until next time, I guess. Any final words, closing remarks, anything? Okay, then we'll see you guys next Monday. Thank you all for watching.
All right.
Bye for now.
Everyone.